So welcome to MLT case study series 9. Today's case study is about congenital afibrinogenemia. So afibrinogenemia is a rare hemolytic disorder. Is characterized by absence of significantly reduced levels of fibrinogen, a critical clotting factor in the blood. This condition can lead to excessive bleeding after injury or surgery, and in some cases spontaneous bleeding episodes. It presents an excellent case study opportunity for medical lab technologists, highlighting the importance of laboratory diagnosis in rare bleeding disorders. So this case study, patient is 8 years old and he is male. Presentation complaints include the patient presents with spontaneous bursting on the legs and arms, a history of prolonged bleeding from minor cuts, and bleeding gums during tooth brushing. Medical history: no previous significant medical history has been found. No known family history of bleeding disorders has been identified. Physical examination: multiple ecchymosis of various ages has been noted on the limbs and no signs of joint swelling has been seen in the patient. Laboratory investigations: we have performed CBC. CBC came in normal limits. Prothrombin time was slightly increased. Activated partial thromboplastin significantly prolonged and thrombin time markedly prolonged. Fibrinogen assay detected undetectable levels of fibrinogen. And diagnosis: based on the clinical presentational lab findings, a diagnosis of congenital afibrinogenemia has been made. The detailed test results: so CBC came normal limits. Interpretation: rules of thrombocytopenia, there is a slight decrease in the platelets. And PT, so prothrombin time normal value is 11 to 13 seconds, but it is slightly prolonged in this patient, suggesting a coagulation pathway involvement. Then activated partial thromboplastin normal is 30 to 40 seconds, but there is slightly increased values has been seen in the patient, indicating intrinsic pathway disturbances. And that means in this patient intrinsic pathway disturbance has been found, coagulation pathway involvement found, and the slightly decreased thrombocytopenia has been found. Whereas thrombin time is normal is 14 to 19 seconds, but it is markedly increased, directly indicating fibrinogen deficiency. And fibrinogen assay has been directly confirmed the diagnosis of afibrinogenemia. Detailed explanation. So medical lab technologists play a crucial role in diagnosis of afibrinogenemia through the performance and interpretation of coagulation tests. So CBC is used to rule out other causes of bleeding such as thrombocytopenia. PT and APTT, these tests evaluate the extrinsic and intrinsic pathways of coagulation respectively. In afibrinogenemia, both can be prolonged due to absence of fibrinogen, which is essential for final common pathway for clot formation. Thrombin time, this test directly assesses the conversion of fibrinogen to fibrin. A markedly prolonged thrombin time in the context of normal PT and APTT suggests defect in fibrinogen itself. Fibrinogen assay, it is a quantitative measurement of fibrinogen levels confirming the diagnosis in afibrinogenemia. Fibrinogen levels are markedly low and undetectable. Clinical significance: the diagnosis of fibrinogenemia has significant implications for management. Prevention of bleeding. Prophylactic treatment may include fibrinogen replacement therapy to prevent spontaneous bleeding episodes. Acute bleeding requires a prompt fibrinogen replacement to achieve hemostasis. Surgery: patients undergoing surgery require a preoperative fibrinogen replacement to prevent excessive or preoperative bleeding. Educational importance: for medical lab technologists, this case underscores the importance of thorough understanding of coagulation cascade and role of fibrinogen, the critical role of laboratory diagnostics in identifying rare bleeding disorders, guiding treatment and preventing complications, the need for meticulous technique and interpretation in coagulation testing to ensure accurate diagnosis and effective patient management. This case study highlights the intersection of normal presentation, laboratory diagnostics, patient management in rare disorders like afibrinogenemia, emphasizing the crucial role of medical lab technologists in patient care. Thank you so much.